the crisis that we're seeing in addiction in our country. This is not a new crisis, but it's certainly geometrically exploded with people being trapped in their homes during COVID. There are two people we're going to share with us briefly, just two in this category, because it's hard to find people who are really innovating and getting real results in this area that are different when the approaches to dealing with these addiction processes have been kind of institutionalized. So you're going to hear about two of them that almost sound like magic. I think you'll leave here very excited about them.
Tony, I can't thank you enough for inviting me. I'm just struck by how many incredible people are here, inspiring hope. And I think if there's one thing that I want to share, it's that there's reason to be hopeful that addiction actually can be treated and can be treated successfully. And we have been doing a woeful job of that, frankly, for the last 50 years, for the last 100 years. And I'm here to talk a bit about how it can be different. How might new treatment look? What can evolve so that this can actually be successful for patients? Today, alcohol use treatment means you get up, you decide you're ready to apparently, bar your soul to the world, and you tell everybody you need 30 days away, and you go inpatient. And when you do that inpatient treatment, essentially what your day looks like is 9 hours a day roughly of sitting in groups, working the 12 steps. By the time you leave that program, what they usually do for follow-up is they recommend that you go to 90 meetings in the next 90 days. That's sort of standard of care today. You may see a physician at the early part of your treatment in the first 3 days when you're going through detox. You might be given medications at that point for those first few days just to make sure that you don't have a seizure. But then you're sent home with no medications, on no medical follow-up, with no follow-up of any kind, really, other than to go to community meetings. To me, that's a problem. So we created NorthStar Care with the vision of developing the first alcohol program that would be, number one, in the home, number two, completely accessible, number three, a year long, not a month. I don't know of any behavioral health illness that you get better from in a month. And we've come up with really the first comprehensive biological and social support network for patients throughout that entire year. I can tell you that I'm very pleased to say that we've moved the needle quite a bit. The 13% success rate of rehab, we're now achieving 86% success rates.
Let's hear it.
Thank you. And I'm excited to show you a little bit of why. So let's talk about the why. Like, what are we doing right now and why isn't it working? Well, we're not addressing brain health. We have to be addressing the core problem that's happening in the brain that's causing people to not do well and not to respond to the treatments we're offering right now. If you look at the left-hand brain, that's hopefully what all of us are still firing at, although maybe a little bit less. It's towards the end of the day and you're all probably tired. But in the morning after coffee, ideally that's what your brain looks like. That represents a PET CAT scan, and it's sort of showing the activity level that's in the brain. When you look at that middle brain, that's what it looks like when someone's come out of detox 10 days ago. So just 10 days out, look at how functional the brain is. Essentially, it's basically shut down. And I would argue this is a nutritional problem. And I'm going to go into that a little bit more. But suffice to say that when you consume alcohol, you're consuming a solvent, right? I mean, basically, you're consuming something that wipes out all the healthy bacteria that live in our gut. And you're also affecting the lining of your GI tract and making it just very difficult to absorb the nutrients that you need to manufacture the neurotransmitters in your brain that make your brain active. So advanced alcohol use disorder leads to a brain looking like that. 10 days out, you come out of detox, how likely do you think you are probably going to be successful in making good decisions and having learned from your treatment? Probably not very successful. Even 100 days out, the brain on the right-hand side, the far right, that's only functioning at 20-25%. And again, because nobody's addressing the core problem, which is brain health. There are actually 30 medications that are available that are incredibly effective in the treatment of alcohol use disorder. They're just not being used. Less than 0.4% of people who go into treatment are placed on any medication. And guess what? They're typically placed on the same medication. It's called naltrexone. And it turns out that genetics tell us that only about 60% of people naltrexone will work for. So we're giving very few people medication at all, and the ones we're giving, we're not using genetics to guide us. This shows you the 30 different mechanisms of action. In other words, we can use combinations of different medications for different patients. We can use genetics to help us to know which medications are likely to work for which patients. And we can also use a combination of different therapies to address the different symptoms that they experience. For example, sleep loss is a huge problem for people with alcohol use problems, and cravings are a big problem. I'm going to use an example of one of the key nutrients that I've been talking about, And it sort of boggles my mind as a physician that this isn't addressed more widely, because I can tell you we were all taught that magnesium becomes extremely low in patients with alcohol use disorder. So magnesium plays a role in 300 different reactions in our brain. It's absolutely critical. When you have very low magnesium levels, you're actually at risk for seizures. You're at risk for heart arrhythmias. A big part of why people land in the hospital with atrial fibrillation, which is a common heart arrhythmia, is alcohol. And so this is just not getting addressed. By aggressively replacing magnesium, we actually improve patients' symptoms. When they drink, their kidneys lose magnesium. Low magnesium actually triggers a craving for drinking and also causes hangover symptoms. So what happens, hair of the dog that bit you, the next morning people consume alcohol again to try to relieve those symptoms, and then they lose more magnesium. So just aggressively replacing that, we can actually help people feel better, sleep better at night, and feel more normal. You can't address all of the issues that happen with alcohol use disorder without addressing it in a very comprehensive way. So our team has, of course, therapists on the team, but the team's led by a physician. And they oversee nurses, nurse practitioners, navigators to help patients sort of navigate the system. But they also are meeting regularly with peer guides, people who have lived experience themselves. And we talked about experience early and how important that is. People who've actually been there are the people that these folks really need to talk to and learn from. We've also built an application just to make life much easier for patients, because they're doing all of this care from home. We have to deliver this care to them at home by using telehealth. We use digital tools like a digital breathalyzer that reads back to the application and tells us whether the person's drinking or not. And we're in the midst of developing a tool that's a wristwatch that will actually help us to monitor alcohol in real time, 24/7. And then lastly, we do something really novel. We use virtual reality. We decided to implement using virtual reality as a way for us to be able to enable patients to connect with one another. And there were a number of different things that came out of that we didn't expect. We loved the fact that it would be actually anonymous. One thing that AA is not is actually anonymous. But as an avatar, you are actually anonymous, right? So you can go in and be any color, any gender. You can actually mask your voice so that no one can hear you. I often joke that Cher could be in the group and no one would know, right? So this way people can actually be themselves and be free. And I think that's really important. The second thing that we've come to really love about this is if you do go to rehab, you're going to be sitting next to people with multiple different kinds of addiction issues. They could be gambling addiction, it could be meth, it could be cocaine, it could be alcohol. But none of those things bring you together other than the theme of addiction. Whereas I think that it's much more beneficial to be not only meeting with people who also struggle specifically with the addiction you have, which is alcohol use, which is very different than a cocaine or a meth addiction, for example, or a gambling addiction, but also to do that with a group of people who know your life in some ways that other people don't through experience. So we have groups that are specifically for veterans. We have LGBT groups. We have groups that are for women with children under the age of 5, which, by the way, was the group hit the hardest through COVID. So we've specifically hired peer guides who match those descriptions. We have veteran peers. We have peers who are women with children under the age of 5. Let's create groups that actually create connection so that people have a shared lived experience, not just a shared addiction experience. So we have a system today that cranks people through. It's actually part of the business model. About 40% of people who are in rehab right now were at that same rehab before. The average person goes 5.4 times. If you had to go to 5 different oncologists before you found the right treatment, we'd have a real problem. So patients are basically rotating through all of these different aspects of treatment, going to rehab, going to detox, coming back out, going to a partial hospital program, going to counseling, and then circling back again. It's just not working. So we send everything to this patient's home. We can get them into treatment overnight. That's the beauty of telehealth. They don't have to fly anywhere. There's no resort to go to. We're now fully integrated in their home. We provide them with all of the nutrients that they need to do this work over the first 90 days. We provide them with a VR headset so that they can engage. If they don't have a tablet, we will send a tablet to them so they can do their telehealth visits. All of these comprehensive things are what you need in order to be successful. It's a real wraparound program. And after a year, patients really, their lives are utterly changed. I really appreciate the opportunity to speak with you today and tell you about this.